But for us specifically here in the Homelands, the risk is significant in that due to the remoteness that we have and the resources that we don't have. If they open the borders and we see what they're predicting to be a surge in COVID cases, and given the nature of homeland life where, people, the young will move from homeland to homeland, different family country, their grandmother's country, their mother's country, we would see it spread like wildfire. For the Homelands, we have the Gove District Hospital, which for some people is up to 300 kilometres away, via one dirt track.
So each homeland would have a medical clinic, but how many staff would there be in that?
So we work on an outreach basis. So we service, there's 21 communities, and of those health services, up to 15 of those communities. And we work on an outreach basis. So the nurses drive out, spend a couple of days in each community, and then drive back again. They don't have a permanent clinical staff out there. They have an Aboriginal health worker in the community who's a liaison between the primary health service and the community. So you've got communities that don't even have a clinic, that don't have Wi-Fi. They have a public phone, and that's the only way for this community to reach out. We take satellite phones out with us.
So what happens if someone gets COVID?
In one of those tiny communities where there's only a public phone, they would ring us on the public phone, tell us someone is sick, and we would try and arrange retrieval. If we've got nurses in a nearby community, we might send them to that community. But as I've said, resources are scarce.
How have you got so many people vaccinated?
I think in general we underestimate the ability of Indigenous people to understand and make good decisions. I think it was just getting out with the true story. We're very lucky here in that we have good staff retention, so our nurses have excellent relationships with the Yolngu. They are almost like our family. It was just telling the true story, really, and people understand that vaccinating themselves is protecting their whole community, not just themselves. Mm-hmm. And because Yolngu, are all about family is everything. So protecting their family is number one. We didn't have to do much convincing at all in the Homelands. People engaged with the health service.